Hello guys, welcome to my YouTube channel medicodelearning. The motto of this channel is to guide everyone out there who are interested in building a career in medical coding. If you are really into it and confused about what medical coding is and how to start and what the future holds, and yes, you are in the right place. In this video, you will get to know what is medical coding, who are really eligible for it, and what to do exactly to become a medical coding, and what myths you should not fall regarding the medical coding as a beginner. So let's get started. So firstly, what is medical coding? Medical coding is the process of turning doctor diagnosis, treatment or procedure into special codes. These codes are used in hospitals for the insurance claims and medical records. Okay, so most of the people in the world has medical insurance for the treatment in the hospitals, and in case of any need for the diagnosis, the doctor will treat the patient without any charges by claiming the insurance. When the patient has come for the treatment, he will do the registration and verification, and he will interact with the physician, and their interaction will be recorded in dictaphone. The recorded information will convert by the medical transcribers, and they convert that audio into medical documentation, and here comes the medical coders. The medical coders convert the documents into medical codes and send them into insurance and billing companies, and this is called AR department, nothing but account receivable department. And now they will decide whether the insurance is claimed or not. And next, here comes the denial coders. They will cross check the mistakes by the medical coders and rectify them and send the money directly to the doctor. So this is the whole concept behind the converting medical documents into the codes. So now we will look into why this coding is important. Let's imagine this. A patient goes to the hospital with a fever. The doctor examines the patient, gives a diagnosis, maybe it's a viral fever, and gives a paracetamol or injection. All of this, the diagnosis, the injection, and even the consultation needs to be recorded, not just for the medical reasons but also for billing insurance. But here's the thing, the insurance companies don't understand the medical terms like fever or paracetamol. They need it in standard codes that can be read by the systems and processed quickly. That's where the medical coders will come in. So this is the whole reason the medical coding plays a crucial role in the hospital management. Now let's talk about who can become a coder. To start a good career in medical coding, you should have a background of a life science from any science department, and do not fall for the myths like a non-life students can also enter into the medical coding, because there will be no opportunities for non-life students in the medical coding. Even though it has, you might be in trouble of understanding strong medical terminology, which is the backbone of this course. Okay, so coming to the point, we'll have some particular certifications in the medical coding which boost your skills in the coding and find better opportunities in the career. So these are the following certifications we have. AAPC, American Academy of Professional Coders. Now these will provide CPC, COC, CIC and CRC. And next, AHIMA, American Health Information Management Association. These will provide CCA, CCS, RHIT and RHIA. So these AAPC and AHIMA, AHIMA, these are the managements from America which provides the medical coding certifications. Okay, we'll look into the certifications. The most common certifications are CPC and CCS, because most of the opportunities will be opened by the certifications for freshers, like as a beginners. So now coming to the subject for the CPC, which is Certified Professional Coder, we will use mostly three types of codes: ICD, CPT and HCPCS. For coding of diseases, we use ICD. For the coding of procedures, we use CPT. For the coding of supplies or equipments, we use HCPCS. Supplies or equipments means ambulance or ventilatory services or anything. Okay. Now coming for the CCS, which is Certified Coding Specialist, we mostly use ICD, ICD-PCS, HCPCS Level 2 and CPT. For the coding of diagnosis, we use ICD. For the inpatient procedure coding, we use ICD-PCS. For the supplies or equipments, we use HCPCS Level 2. And for the outpatient procedure coding, we will use CPT. So by this we can understand CPC is used for outpatient procedure coding and CCS is used for inpatient procedure coding. Let's look into the fee particulars for these exams. For the CPC exam, we have to pay $721, like in Indian rupees it almost 60,000. For the CCS exam we have to pay $434. In Indian rupees it might be 37,979 rupees. So before paying the examination fee, you have to check these fee particulars in the AAPC website, which gives you the present exam fee for the CPC and CCS. Okay, now look into the exam pattern. We have 2 attempts for the CPC and we have 100 questions and have to score 70 marks to qualify. The time duration will be 4 hours, and for the CCS exam it will be only 1 attempt and we have 150 to 140 questions, and the time duration will be 4 hours and we have to score 300 marks, and the negative marks are also included in the CCS exam. So these are complete information about the certifications to enter into the medical coding. What about the scope and salary in 2025 for the medical coding? So as a certified fresher, if you are CPC certified or CCS certified, you might get 20,000 to 30,000 of salary per month, and it may vary based on departments like you do, like HCC, surgery, E&M, radiology, pathology, and etc. But what about if you are non-certified? If you are unable to do your certification like CPC or CCS, you can also enter into the medical coding without certification as a non-certified fresher. You will get 15,000 to 20,000 of salary per month, and it may vary based on any company. Like some companies will also sponsor you some certificates like CRC, CIC, etc. anything. So now let's talk about the major point, myths you should not fall as a beginner. Don't ever go for fast track courses in institutions without 3 months of proper coaching. So some institutions will say that you only need 15 to 20 days for the training of CPC, but they won't train you about medical terminology and anatomy. And this might be throw you into the trouble while interview, because companies will ask about the basic questions about medical terminology and anatomy. You might pass the CPC exam, but you don't have the knowledge about medical terminology and anatomy. So invest your time like 2 to 3 months and learn about medical terminology, anatomy, and take some mock test and then attempt the exam. Okay, so the next one is, don't even trust that non-life science students can also sustain in the medical coding. Okay, so note this point, there are less and less opportunities for the non-life students in the medical coding, because the highest priority will be given for the science students, and non-life can easily terminate at any time. And next, don't pay the CPC and CCS exam fees without checking the original price in the AAPC website. Some institutions will make you pay the more amount of exam fees compared to the original fees. So before paying, just check in the AAPC website what is the actual price up to the date. Okay, so the next point, don't be nervous because of high competition in this field. Learn to trust that skills will make you grow. The more you learn medical terminology, anatomy, and the guidelines of ICD, CPT, and HCPCS, the more opportunities will be there in front of you. There are many companies out there that are hiring the more skilled persons in the medical coding. Okay, so this is the whole introduction of medical coding, and in the next video we will learn about basics of CPC exam, medical terminology, basic guidelines of ICD book. So okay, if you have any doubts regarding the introduction of medical coding, you can comment me down, and please share, like and subscribe to my YouTube channel, and share this video to all the life science friends out there and who are willing to enter into the medical coding. Okay, thank you.